June 5th. Is that tomorrow?
Yes. Are you coming?
I don't know.
So I was afraid that would be.
I'm going with my Billinger on an outing.
You should bring some try it.
That's well, I could mention.
All right, well, go ahead. We will go ahead and start. Let's stand for the pledge, please.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you, everyone. So we'll start with approving our minutes from our last meeting. If we can have a motion to approve.
I move to approve the minutes from the May 7th meeting.
I'll second it.
We have a motion and a second.
Okay. Dr. Thompson?
Yes. Sorry, that's okay.
Dr. Brunt?
Yes.
Kathy?
Yes.
Dr. Osan?
Yes.
Thank you.
Thank you. We luckily have a quorum here. So our next meeting is scheduled for July 2nd. Hard to think about that we'll be halfway through summer by then. So I hope time moves slowly between now and then. All right, new business. We have a few things to discuss. I'm just going to move around things on the agenda a little bit. We're going to start with the Powers Health proposal, just to let our guests go first and not make you stay the whole time if you don't need to. Enjoy your summer evening. I think there might be movies out there. We're happy to have you. This is Shannon from soon-to-be Powers Health, right?
Soon to be Powers Health, yes. Community healthcare system will be moving to Powers Health in July 1st. So just a couple of weeks. So we're working hard on getting all of our signs and our staff.
A lot, yeah.
Yeah, that's a lot.
Rebranding, yeah.
Yeah.
Well, thank you for joining us. Let us know what you're here to speak to us for.
Sure. So, and I know you guys have had this for a while, so thank you for being patient. We wanted to make sure we did our due diligence. These ladies over, Carrie Gushwin and Carrie Honeycutt really helped me to make sure that this was a perfect partnership and it really met the needs of our Porter County residents. Our healthcare system has a commitment to our community, and with my program, we have the possibility to affect 66,000 lives here in Porter County. So I've named my program RUDI, R-U-D-I, which stands for Reducing Undiagnosed Diabetes in Porter County. I am a registered nurse, and I am a certified diabetes care and education specialist. So of those people with diabetes, 1 in 5 are actually unaware. Through my program, I seek to actually increase the rates of prediabetes diagnoses here in Porter County. Diabetes is a top need, and it has remained so for many years. But the data is based on actually getting a diagnosis. So rates are dependent on a health visit and a diagnosis. My program is not a duplication of services. So RUDI, or the Reducing Undiagnosed Diabetes Initiative, brings lab quality A1C results on location. For those that score high risk on a diabetes risk assessment, an A1C will be offered to them on site with a finger prick only. So access to health care, ability to pay, or simply time are big barriers for individuals. Some people are simply terrified to visit a doctor. Lab draws, white walls, all of these things are scary, so my program seeks to overcome that. A1C machine, an A1C analyzer takes just a couple of minutes to result in A1C result. An A1C of 5.7 to 6.4 would let your patient know right away that they fall in a pre-diabetic range. 6.5 or above is diabetes. So as a nurse, I cannot diagnose, but I can let the patient know what ranges they fall into. What I hope to do is make this a full loop program. So not only are we giving the patient the result of the A1C, but as a diabetes educator, I'm going to be getting them into education immediately. Here at Community Healthcare System, we have a robust diabetes education program, anywhere from the Valpo Health Center all the way over to Community Healthcare in Munster. But sometimes that's not the best option for the patient. So working with the patient on what location and where they want to go is the key to this. Whether it's with community health care, whether it's with HealthLink, whether it's Franciscan, that's what I'm going to be helping the patient with. Because as we know, whatever's closest is where it may be the best option and the only option for some people. Maybe they need rides, or they need to take the bus, or coming to education needs to be easy, needs to be fast. Maybe that's a virtual option. So we will also be collecting, I also have a data collection snapshot, if you all want this. We'll be collecting things such as history, the questionnaire results, BMI. I hope to hit the key indicators that you had on your community health needs assessment, so that we can know if this program is working, where it's working, and where we need to work harder. So one of the questions that we had was, where do we need to be going? We need to be getting out to those communities that have low rates of people seeking healthcare. So that's why the mobile unit is also going to work really great. So working with them, going on the mobile unit with them, going to the communities. I'm not going to take a desk and sit in the middle of a neighborhood. The mobile unit is the ones that are going to be doing that. So when the patient gets a high A1C, I'll start education right there. So a risk questionnaire asks things like age and gender. Those aren't things that we can change, but things we can change are things like weight and activity. While the A1C analyzer is resulting that A1C, I'll start going over those modifiable factors with that patient. Are you active? How can I get you more active? All right, so if they do get a pre-diabetic, if they fall in the pre-diabetes range, diabetes prevention programs are available already in the community. I don't wish to repeat those services. They're already pretty robust in our area. So for instance, Portage YMCA is going to be starting one soon. I can say, let's get you signed up for that program. They're now in the YMCA. Maybe entering those doors is something that's difficult for some individuals. Now I can hopefully, once I bring them in those doors, hey, let's get you into some classes. What about a membership to the YMCA? How can I get you more active? Once that A1C results, we know if they're pre-diabetic or diabetic. We can get them signed up for the appropriate classes. And then a physician does need to confirm that diagnosis, because as an RN, I cannot provide a diagnosis. So we can get them into whatever physician they prefer. I actually have a quick way for us to get them an appointment. A lot of the websites now have it where you can click and go ahead and get that person signed up for the appointment. So if the patient does say, I need to visit an FQHC, we can get them signed up with HealthLink or North Shore. If they say, Franciscan is closest for me, I can get them an appointment right there online. But being a nurse for over 13 years with this healthcare system, I know a lot of the physicians. I can hook them up with someone who maybe fits their criteria. Maybe they want a female, maybe they want someone close to their home. Of course, I'm going to be helping them with physicians in my healthcare system, but that isn't a barrier that we have, right? So we will be getting them an appointment for what works for them, or maybe their insurance. Did I explain that program well enough?
I know you've put in a lot of time and a lot of communication, like you said, with our staff.
Yep.
And very well done.
Thank you.
You guys have put in a lot into this, and I think this is an exciting venture to get that middle point, to get people to acknowledge. I think one place I've read, like, someone could be diabetic for up to 7 years before they even know that they're diabetic. So if we make it easy for people so they don't go to some huge lab and have this blood work with
You have to
huge
wait for
deductible, be fasting, all that stuff, to remove all of those barriers, I think is extremely exciting and beneficial to our community.
It's really the missing piece, right?
Yeah.
Like I said, it's very scary to go into the doctor's office, and then I can speed up that process, right? We can already get you into the diabetes education classes, which for most don't require a doctor's order. And I at least know the ones through my healthcare system are completely free.
Which is amazing, because most people's insurance don't cover those types of things. So when people know that there's free access to these types of things, I think it's wonderful.
And again, it's the missing piece. So I've been a diabetes educator for 13 years, and I see the ones who have the diagnosis, right? So somebody already told them, but who told them? What about the people that they've no one ever told them. So things that I would hear when I would visit these patients, whether they were in the hospital or in the class, they would say, I didn't know, I felt fine, you know, or they'd say, I wish I knew earlier. And then, you know, if they did have advanced diabetes, will my vision return? Is this neuropathy permanent? Is that why I couldn't get pregnant? So these are the things that we can catch early for these people.
And you said that you're going to be going on the mobile unit,
When invited, yes.
and then do you have another location where people will be coming to you, or will it all
Yeah.
be outreach?
This is a great question. So I already do outreach and have been doing so for a couple of years. And the risk assessment, that is the first piece of this, is something I was doing already, but it just didn't hold value for people. I would say, hey, you scored a 6, you know, that puts you at a high risk. Okay. And they would just move on. And I would say, hey, we have these diabetes classes. You know, you scored high risk even without a diagnosis. You can go ahead and come to these classes. It just didn't hold weight. It just didn't hold value. The A1C analyzer is really just the second piece to say you're at high risk and your A1C is 8. So
And
that stops them.
so for the follow-up metrics,
Mhm.
you know, you do the assessment, you give them the feedback, you enroll them in education, they go visit their physician.
Mhm.
What's the outcome measure then? I mean, is it the follow-up in and of itself? Is it the lowering of the A1C? Like, what is the metric that you're using to measure success of the program?
Sure. So we'd like to follow up with the patient in 3 months to make sure that so on the data collection snapshot that I have here, you'll see at the very end of it, there is a 3-month follow-up. So we will be giving anyone who comes in that 3-month call. How's it going? What have you done so far? At 3 months, we can do another A1C to see change. So A1C, in less than 3 months, you won't see a lot of change. But after that 3 months, you'll see that change. But maybe they've done nothing. So we actually did a recent screening, and that patient needed to visit the doctor, and I followed up with them via email. Hey, did you go? Crickets. So I emailed him again, and he then followed and made that appointment. Sometimes you do need that extra push,
Check-in.
and you need that nurse caring about you to say that this is really important.
Okay.
And that you have the power to change, especially if you tell someone, hey, your A1C is 5.9, you're in the pre-diabetic range. You have the power to change things. You have a power to turn this around. If we turn it around for patients who are parents, that can change what the household is doing. You know, mom and dad buy the food.
Right.
So we have the power to change generations as well. The U.S. PTF, which is the U.S. Preventative Task Force, says that anyone 35 or older who's overweight or obese should be screened for diabetes. Screening has to be an A1C, a fasting glucose, or a glucose tolerance test. None of those are a finger prick at a random health fair. You have to do an A1C to let them know. And actually doing a finger prick is a little bit irresponsible, because if you have a perfectly fine finger prick at a health screening, you may think that you're fine, and you might not be. So.
Thank you, Shannon, for coming.
Thank you.
We're really excited about
Yes.
this program.
Yeah.
I do have a couple questions, and maybe you can
Perfect.
clarify or see chances for expansion going forward. This is for adults only, right?
We do have it at 18 years or older. If they're under 18, you would need parental consent. Pregnant women actually can participate, but when it comes to the weight category, we would have to use a pre-pregnancy weight. So could we do this for children? Yes, we could.
Okay, so maybe as we see what demand there is, and if there's any interest at these health fairs to have children tested too, that might be a place for expansion, getting something set up for parental consent and that kind of thing.
Yeah, so we do have a health screening consent that they would sign before doing the test. So as long as the parent signed that would be something that we could do. I would just have to double make sure there was no extra loops that we had to go onto. But as long as we do the health screening consent and the parent's consent and the child is agreeable, we could do the children as well. Yes.
With your screenings that you currently do, and going forward potentially with the A1C also, are the BMIs, do you carry a scale with you? Are the BMIs calculated? Do you just take kind of what the clients thought about their weight and their height is, or how do you do that usually?
So they will be weighed, because I do not want people telling it's not,
Thank
not
you.
correct. So I will have a Tanita scale with me. Tanita scales are a little bit bulky, so in actually my proposal, I took the word Tanita out of there because you could use a traditional scale. And the Excel sheet that I made will actually calculate BMI for us, but the Tanita scale is going to give you that printout as well. And that would calculate the BMI, which is one of your key performance indicators, yes.
And do you find that when you're doing screenings now, do you find that you have people who are hesitant to step on a scale?
So we do
Yep.
have barriers, mobile barriers that we would bring that we would put in front of the scale because that is a bit intrusive, right? Stepping on the scale and having to weigh that. When it's, especially in the mobile unit, we would have the privacy for that. When I've done other screenings at other places, such as the Hobart YMCA, they give me a side room for screenings. Blood pressures, usually we can do that out in the open. But if the room allowed it, we would absolutely provide that privacy. But we do have privacy screens for our screenings that we do.
Nice, that's helpful too.
Yeah. And with the Tanita scale, the unit that actually weighs them isn't like up on display. It's a little thing that we would, of course, keep so others couldn't see that. Yeah.
Discreet, yeah.
Just like the doctor's office was right there for everyone to see.
And
Yeah.
where is the protected health information stored?
This is a great question. So I have a hospital-issued laptop, which therefore our files are held within the, I'm no IT person here, but
So it's like secured, encrypted,
Yes.
HIPAA compliant?
yes. So all of the information will be HIPAA compliant. Actually, extremely diligent about HIPAA.
Yeah.
So all files would be held in our drive, I guess you would call it. And the drive is, again, on a hospital-issued computer, and a hospital drive is where we keep all of our patient information. And that's something that we do already, because we already have programs which we capture patient data, and that's already kept on those drives. Yes. Yes, and then if we did need to send it to the health department for anything like that, our emails can then encrypt the information when we send it over. Yes. Because that's something we want to share with you so that we can show that the program's working and those follow-ups are working and the number of people that we're able to reach, which is really important.
Would you be able to share the information with the patient's physician?
Yes, that's the other thing. So the health screening, so anytime the patient says, can you send that information to my doctor, there is a consent for that as well. Because even though a patient may have said that, it needs to be in writing, right? So the data will be entered in Epic, which is an electronic health record. Once it's in Epic, a lot of physicians, as long as they have Epic access, can then see that, but they're not going to see it unless they're triggered. So you can do what's called an in-basket message, which connects the patient to that lab result to let the physician know. So if I said, Dr. So-and-so, Linda Brown had an A1C that was high in our screening today. She's supposed to be following up with you. She says she has an appointment next week. Here's the lab result. So it's not actually sending it to the physician rather than just linking the result to their electronic health record. If they were outside of Epic, I would contact the doctor's office to let them, or to ask them, what's the most secure way to send this over? They may just say, just let me know what the result is. And they would put it in their chart as well. Or the patient's going to be getting a printout as well. So the A1C analyzer actually has a printout, and so the patient will actually have that printed result for them, wherever they want to take it.
So then in the data collection consent,
Mhm.
there is a line noting that their patient information will be de-identified as it's lumped into a larger group, right? Because data, there's no way that it could then be tracked back to the person. The data that we receive will just be like 50 males and 25 females, right? Okay. I just want to make sure they understand that the data is being collected might be shared, with the public agency.
Absolutely. So, and we can double check those consents and make sure that they're all up to date with,
Yeah.
The guidelines you need to follow and the guidelines that we follow as well. But, knowing that this is a partnership, but yeah, the data that I would share with you would be, numbers, different, those key performance indicators that you're looking for, those with a BMI over whatever are falling within the diabetic category, or, we saw 50 patients last year, and 5% were referred to physician, or of course it'd be higher than that. 80% were referred to physicians, or if it fell with after 3 months, we say, we followed up with this many people. Some of them still needed a physician appointment. Some of them, this many people completed a diabetes class, and this many people completed their physician appointment. And those would be phone calls that we make. And I also have a hospital-issued phone that we then call patients with, and they're able to call us back and leave secure voicemails as well.
Very good.
Okay.
If I may, I want to make a comment. I think there's been a huge paradigm shift in the treatment of diabetes over the past 10 years, especially with the medications that have come out. For me, the distinction between prediabetes, insulin resistance, and diabetes is non-existent. Saying somebody is pre-diabetic is akin to saying you're a little pregnant.
Exactly.
There really is no difference there, and I try to reinforce that with my patients. And although I work for the system, and obviously I'm not going to be able to vote on this evening, I do want to make the comment that we have been able to intervene much earlier, and we have been able to be much more aggressive with the treatment of diabetes, whereas the goal A1C for decades has been 6.5. To me, that's like stopping 100 yards before the goal of the marathon. My goal is a metabolic profile that is back to normal for my patients and undoing the metabolic syndrome that underlies this disease that has plagued us. So this is going to be a phenomenal tool to identify those patients that can be intervened with early before it's too late, before they have the diabetic complications. So excellent. Thank you.
A lot of times we can't get insurance coverage for this type of testing until the patient has it,
Right.
has really high identifiable risk factors. And so people are so worried about the copay or the bill that they may get. And so this is such a huge loss of barrier to that, to just be able to go and do this without worrying about the cost of the lab. How do we know to help these people if we don't test?
Right.
And sometimes they don't have all the different bells and whistles that the insurance wants them to have to meet those criteria. And so, we didn't get an elevated fasting blood sugar. So, they want that before we can order an A1C. So this is just so perfect, to have that without people worrying about that barrier. The cost is a huge barrier. The insurance is a huge barrier.
Yeah, again, I've been in diabetes education for 13 years, and this is the missing piece.
Yes, yeah.
So like I said from the beginning, my goal is to actually increase the rates of prediabetes diagnoses so that the rates of diabetes then can decrease. Finding them as early as possible.
Turn it around.
So even if someone had, say, an A1C of 5, so then when they follow up with the doctor and maybe they got a 5.3, and the doctor said, oh, you're good, 5.3, they might say, hold on, I was just 5. So watching trends is also really important when it comes to A1C.
Very good. So I know you had said you're going to, since you work in the same hospital system, he's going to be present to meet the quorum criteria. And then we will, if there's a proposal to approve the Powers Reducing Undiagnosed Diabetes in Porter County program, we could move forward with voting. Motion for the.
I move that we accept the Powers Diabetes Program, help put it into effect and be helpful to the residents of Porter County.
I second it.
Okay. Dr. Botsom?
Yes.
Dr. Brunt?
Yes.
Kathy?
Yes.
Dr. Rosan?
Present.
Thank you.
Very good.
Thank you all.
Thank you. We're excited to work with you
Thank you.
and appreciate you. All right, so we will move back in order. The first subject at hand is the current health officer's salary. So we still have not had any applicants for our health officer position. We are looking into increased methods of getting the word out there in regards to this opening. Some of that is going to require, I think, a cost investment if we're going to do more advertisements. But we have an advertisement budget that we can work with. We're also thinking of people, contacting people. The process is pretty ongoing in terms of our wheels spinning. But in light of that, when we approved this new position, we approved it in hopes or thought that we could begin now in June if someone had applied and was approved by us. So that position and the salary, up to the full-time salary, is available to us to use if we were to have a new health officer. But we don't. And we graciously have Dr. Stamp here still with us. And we are extremely fortunate to have her with us still. And my proposal, if the board is in agreement, is if we can then increase her current salary to what we devise as a part-time salary, because she wants to stay part-time, in using these funds that we were going to use with a new health officer to compensate her for her work, because her work is, I think, even more than part-time. And we have the funds available. And I think it shows the community our commitment to this new position, and that we are willing to be more committed and include a higher salary into this position. So I don't know people's thoughts.
So I totally agree with that. I mean, until we figure something out. A thought I had the other day about this position and potentially something we could entertain is potentially, and I know you never really want two head coaches on a team, but splitting the position in two so that no one physician has to commit full time to it might be a thought process for options to get more people potentially to apply. That being said, in the meantime, Dr. Stamp, you're amazing, so the answer is yes.
I think, in my mind, to be perfectly blunt, I've been waiting to get through this health fair,
Right.
get that kind of done, and I think we may have to sit down and refigure. I was even considering, speaking with our county council or our commissioners and what their plans are, what their thoughts are, in terms of how I'd like to keep her forever, but I feel like I'm holding you prisoner. So we have, something, we need to think about other options and ideas to fill this position. So yeah, I agree with that as well. I mean, it's a great thought to consider.
Dr. Osen, there's precedent for that too. Prior, not the current setup in St. Joseph County, but the prior setup in St. Joseph County had a health officer and then a deputy health officer. I'm not positive exactly what their job duties, how they were divided, but then also in Allen County, which is quite a bit larger, honestly, than Porter County, twice the size, I think maybe more.
Wow.
But they have a health officer who is part-time, and then they have a full-time clinical. They have a number. They have more than just. They have a couple nurse practitioners, and then they have maybe it's a part-time clinical physician also. So there are other ways to skin the cat, so to speak, that gets the work done and gets the leadership role fulfilled too. So that could be looked at.
So my question would be, the full-time position, we've left open to, I believe, $150,000 with benefits. At part-time, what would that number look like for us to consider for Dr. Stamp? I was thinking close to 100.
Is she not doing a full-time job right now? I mean, I hate to push it, but I mean, until we find her replacement, I mean, she should get the salary of the job.
I'm agreeing. I think she doesn't want to commit to full-time. I don't want to scare her away, but I'm happy to pay her to do full-time.
Not here every day.
No.
Let me put it that way.
No, but I mean, with everything that's gone on with the funding and the increases in programs, I mean, it's not just about being here. I mean, the communication is endless, in terms of the things that go on. I mean, just with what I do, I see how much it is, and it doesn't come close to anything that you,
Yeah,
so,
I mean, when you take into account not just your physical presence in the building,
correct.
but your telecommunications, your email communications, your messaging, your research, I mean.
Putting together those wonderful.
Yeah, all of that time is well spent, and it may not be that you're physically here, but you're doing a lot of work. I mean, you're doing full-time work.
Thank you.
You know, and that it's valuable full-time work that should be compensated.
I agree.
Yeah.
I move to give her the salary until we find her
The
replacement.
full-time salary,
Yes.
The salary as it's been
agreed.
advertised, yeah.
Which would be the 150 with benefits. We have a motion? Do we have a second?
Oh, I'll second.
Very good. Demetrius?
Dr. Thompson,
Yes.
Dr. Brunt,
Yes.
Kathy,
Yes.
Dr. Rosan,
Yes.
thank you.
I'm flattered.
You shouldn't be flattered. You deserve it. You should be.
It's not enough.
It's not about flattery. It's about what
I'm surprised. This is not what I was expecting.
No, I had to, yeah, she's never once, ever once brought this up. You know, this is not something Dr. Stamp has ever asked for, but I think.
And just to be
appropriate.
fair, my proposal, I haven't spoken to Dr. Stamp in probably 3-4 months personally. So that did not come from I have not had any conversations with her. That's just because of the work I see her do.
Right, and I think
Very
it's
good.
appropriate to compensate valuable work. And so.
Thank you.
Yes, we appreciate you. And the work will continue in regards to this health officer role. All right, hardship SOP.
So we talked a little bit last month about how we were in the process of getting together a hardship SOP. And I believe we had kind of presented the framework to that, but we didn't have the official document in front of you. So our proposal, and I believe it was sent out in your packages at the end of last week, would be to review, answer any questions you have, and hopefully maybe make a motion and vote on this as our standard operating procedure for how we handle hardship fund requests. We did work together to put this in writing, and then we worked together with Colby as well to make sure that, we had everything kind of correct as far as legality, and that we were going through the correct processes and take any suggestions that he had as well. So if anybody has any questions about that form or procedure?
I thought it was very well done. I think the parameters that we have in place are very reasonable. And then I also think that, if you were to see something or in a situation were to arise, obviously we're reasonable to hear a specific scenario that falls maybe outside of these parameters and requires the board to review the process. But I think this will make things a lot more streamlined and allow you to do your job without, stopping at every moment and know how to proceed forward without this entire process every time. I think it's very well done.
Do you foresee, Carrie, or think about, just based on past experience, like how many you might be receiving?
I will say it's more common on the smaller denomination size, yes, so.
Records.
Yes, someone who's in need of a birth certificate that's not able to afford it, an administrative fee that maybe somebody's not able to afford, and it's an immunization that they need.
Immunization, yeah.
Yes, that kind of thing. As far as on, obviously, the environmental side,
Yeah.
those are a lot larger, much larger amounts of money. And fortunately, we do not see those come up quite as often. Of course, it was one of those situations where we had something come up, and then, you
But it
have
prompted us.
a few others come up, and then, you've utilized the whole fund. So just, it's in our best interest to have something that
Very
keeps
much so.
us,
Sure.
yeah,
Yeah.
with the criteria that we have, and something that we can tell people as they're coming, and applying or proposing some of those larger things especially.
Okay.
Very good. So if we can have a motion to approve the hardship SOP,
Motion to approve.
thank you.
Second.
Dr. Boxell,
Yes.
Dr. Brunt,
Yes.
Kathy,
Yes.
Dr. Osan.
Yes.
Thank you.
And I skipped because I put
That's
things in
okay.
my binder in a different order. So the next matters are school liaison job description.
When the school liaison grant came to be, we were taxed with getting a job description and setting a pay amount for that individual out of that grant. And it's kind of had a history where the pandemic happened first, and we developed a really strong relationship with our schools during that time. And Jess, who's currently our director of nursing, was kind of their point person for all the guidance that was going out to schools, any questions that they had, any needs that they had. And so then as the grant came, of course, we got in on the very first grant cycle. And at that time, when making a job description, frankly, the school liaison title was just put onto a public health nurse job description. And so then it was decided that the nurses would all share those duties. And for a couple of years, I believe, maybe it was just one, but part of all of their salaries was coming from that fund. And so for 2020, was that 3 or 4? I think it was 2024, we kind of cleaned that up a little bit and made it its own position. What we've seen is that those nurses still call Jess for all of their needs, and we've established such a relationship with them. They know exactly what they can call us for their nursing needs. If they're short on something, if they need a school clinic, it's a great communication. What we've seen out of the student health and the school liaison position is that there are other needs within the school that are kind of different. Well, they are different. So as far as curriculum needs, educational needs, a different type of communication more with administration, kind of talking about the initiative that we're putting together with the Tobacco Coalition and PATH and the Hub, those kinds of things, and being able to utilize that position in that way. So what we've done is written a job description for that position that is in line with the student health and the school liaison duties. And so we're not asking to change anything else, simply the job description. It still may be a nurse, but we're opening it up so that it could be someone with possibly an education degree who maybe has a higher education degree, a social worker who might fit that kind of like coordinator that we're looking for the Ask Initiative, or just somebody that can get into the schools to offer that education, to pick out evidence-based curriculum and be able to deliver it or coordinate the delivery of it. Maybe offer CPR training in the schools, those kinds of things. And so that we're just asking if you would be so inclined, if the board would be so inclined to agree that that would be a change in job description that we would be willing to entertain.
So then, is this a job description or a position that would then be posted to be filled?
Yes.
One that it's sort of already being filled partially by everybody, like.
It was a job that was open at the beginning of
Oh,
this year that we just had not
Hadn't
filled
filled,
yet.
okay.
Yes.
So you're just revamping the job description, maybe making it wider to applicants possibly? like
Yes.
medical, social work, public health undergrads, like people that maybe didn't have a nursing degree?
Right,
that what
because as we've seen, mental health helps, are a need in school, getting some of these programs into the schools. And so we just kind of thought this would open that up to finding maybe a different candidate that's the right candidate for all of the different aspects of the position.
Especially as this is expanding
Yeah.
in terms, it's not just the school nurse and the one-on-one of each individual child. These are more about programs and education.
And that still will be taking place. It
Sure.
still is taking place, day to day.
Yes.
Just kind of saw the need for the position was a little different than we'd originally imagined.
It's growing,
Yes.
expanding position. I think it makes sense. Well, if there are no more further questions, if we can have a motion to approve the new school liaison job description.
I move that we accept the school nurse liaison position as presented to us.
School liaison job description.
Second?
Thank you.
What did I say? Oh,
Dr. Boxell,
Yes.
Dr. Brunt,
Yes.
Kathy,
yes.
Dr. Osan.
Yes.
Thank you.
Very good, thank you. So this will be posted then, again, new?
So we go before the council. So we
Okay.
have to get it approved by the council as well.
Okay.
And then that will we are on the agenda for the June meeting, so that will be the end of June, and then
Okay, and then we can post. Very nice, very nice. Okay. Anyone have old business?
I'm sorry, the
Oh, I forgot, I can't read. What happens when you turn 50? I don't bring cheaters that I need them.
Just a quick asthma grant update. We had announced the award. They've all kind of fallen at strange times, not in line with our board meeting. So we had received the funding for the asthma grant at the last meeting. That was that capacity building grant to get our program up and running. We were on the council agenda at the end of May. We went, they accepted our appropriations, so those funds are all appropriated for that $8,800 from the asthma grant. That's all ready for us to start training and getting our other supplies and materials together for that. And actually, we will get started on that right away because that has to be spent by the end of August. So that was a really quick turnaround.
Okay.
The immunization grant, we had discussed that we had received our award letter at the last Board of Health meeting, and we actually received the details of the grant for signing and execution. And so that award, we announced at the last meeting, it was our ask was for $228,000 and some monies, and they gave everyone $20,000 over their ask.
Wow.
The reason that they did that was in order to purchase, they wanted everyone's vaccine storage equipment to be 7 years or newer, and then everyone to go to cloud-based storage. So they gave the extra $20,000 for that, and they had asked that if we did not need that to please let them know, and they would remove it from the grant. And we actually had done all of those things in this grant cycle. So we actually did let them know that we didn't need that extra funding. In that way, they can reallocate it to somewhere else where they maybe had a need or their whole grant didn't get funded. So that, you have the details of that in front of you if anybody has any questions. And we we were receiving those funds for the grant cycle beginning July 1st of 2024, going through June 30th of 2025. As long as everyone's okay with accepting that funding from.
So the 228,852, that's what we're receiving?
Yes.
Okay, so that 20,000 was already taken?
Yes, yes.
So I guess that means our equipment is newer.
Yes, yes, we actually knew about that ahead from the grants call, and we were able to reappropriate and get that with some funding this year, which they also were really encouraging us to do if we were able to, because of course, anything unexpended goes back to the CDC, and so they always want to see it spent in Indiana as much as it can be.
We can't keep it for when our refrigerators break down or get older than 7 years old.
Not new ones, so we're good, and we did need that we got, so we are.
But you know they're going, at some point, they'll be, need to be.
And we're also very pleased with the cloud. I mean, we don't have it yet, it's not in place. But what we're reading on the cloud-based monitoring as far as the temperature of the units, we're very excited, and that actually will save us some money, it looks like, so.
We do have generators that would kick in.
Oh, yeah.
Yes, they're on a designated circuit with the, we get calls in the middle of the night, and
Yeah.
the building's on.
She has to go in the middle of the night.
We're going to, that is a yearly contract that we've already had to pay for the rest of 2024. So we will run both of them simultaneously at the beginning, and we feel better about that.
Good. Good. Very good. So if we can have a motion to approve the immunization grant, please.
Motion to approve the immunization grant.
Take turn.
I'll second it.
There's not enough of us.
I know.
Yeah.
Oh, we're just moving right along.
Dr. Watson?
Yes.
Dr. Brooke?
Yes.
Kathy?
Yes.
Dr. Rosano?
Yes.
Thank you.
Very good. All right, so now we can move on to any old business if anyone has anything to share. Okay, and then I'm going to combine, I'm going to move the report of the board attorney on with our administrator, because sometimes they share the same information so that you can clarify anything that needs to be with the contracts and matters that you've worked on. Claims and receipts should have passed along to all of us. We all signed? Okay. Has it made its way back?
It's right here.
Yeah. Oh,
Right there.
it's in the no man's.
You might pass.
Awesome. Have a quorum. All right. Reports of committee, staff, and health officer in the order of your choosing. Did you want to go for it?
Okay. I think, some really exciting things. If you'll bear with me, I've got things in several places, so I'll have to see what we've, so Demetrius put this together. We are doing some sponsorships for the YMCA youth sports programs this year. And so as you can see in this first picture right here, we are featured, these are at the Valpo YMCA, I believe. Is that correct, Demetrius, the signage? Yes, and then here at the Portage YMCA, we're sponsoring their youth basketball leagues, and so Jess actually has one of the yellow shirts that we got from them from being sponsors, and on their opening day, Demetrius was actually there, walking around, meeting everybody, handing out service flyers, and getting the word out. Also at the Valparaiso YMCA, that's what's down at the bottom on the screen, we have information that plays on their TV. So right now we're featuring the health fair with the sports physicals and the cardiacs up there right now, and then we'll be able to change that out.
Get help.
And so,
Yes.
Get help on that.
That'll be next.
yeah, yes. So just kind of wanted to share that. That's exciting to
That's
kind of
awesome.
see those things in print, and I will exit out of that really quickly. I also wanted to share, we got a couple of emails today to Chris, Carey, and I regarding the backpacks and snacks program for the summer feeding. In particular, we received an email from Northwest, the Food Bank of Northwest Indiana. One of their individuals that we've been working closely with is actually leaving the food bank, and she sent us an email to let us know and just expressing how excited she is about the programs that we've been working with them to put in place in the county. So we have worked with them through them for our diapers, wipes, and sanitary napkins program, both in our office and out at the local food pantries, and then also for the backpacks and snacks program. And so she just wanted to send us an email to let us know who the new point person was going to be, but also to let us know how excited she was about the programs and the initiatives that we have going on here in Porter County for our families. So I wanted to share that. And then I also wanted to share an email that we received from Aaron Hawkins, superintendent at Valparaiso Community Schools. This says, "Hi, Chris. I was able to work with our team to inventory and pack weekend food bags for the delivery we received last week. I just want to follow up and say thank you. What a beautiful variety of foods you have provided to us. It is wonderful. I am so excited for our families to receive this." And so then she goes on to let us know that they currently have 65 families enrolled for this week, and she'll keep us updated. And she's shared her inventory spreadsheet so Chris can have all of that information in real time. But I just wanted to share it with you because, you know,
So we're doing this with Valpo, and then we're doing it with the Chesterton schools also?
correct, yes.
But can you explain, if you don't mind, the evolution of how, like,
Yeah, absolutely.
because the state was providing this in the summertime before, right?
Yeah, so
That
there-
is now gone. How that all kind of came to be?
It depends on what type, like what the schools qualify for as far as what funding they receive, what title funding that they receive. And so ending this year were some of the funds that they were able to do some of the weekend meals. So when they have summer school, they get meals for families, and they extend it to any family who needs it all throughout the week. But for the summer feed, some of that pandemic era funding ended that the schools were using for that, and they went to an EBT card that they give, and it was $125 for the whole summer to qualifying families, I believe is what it was. And when we had gone out to the schools and we talked to the superintendents, food insecurity was a big concern that they had, and particularly what happens on the weekend. So when the kiddos are in school and they get that lunch, for some of them, that breakfast and that lunch are what they eat for the day. And so then when they go home on Friday, not knowing what's available, some of those kiddos come back in on Monday extremely hungry and not ready to learn. And so they had been able to provide that year-round, where they were sending home snacks in the backpack for the weekend. And then that was going on in the summer as well for those that came and got meals in the summer. So this was a need that we saw, and we knew that that funding was ending, and that had been expressed as a need from our schools. And we had reached out, and we heard back from Valparaiso and Duneland, and we were able to enter into a partnership that's going to start in the summer, and it will go home with those who are coming on Friday to get meals that want it. And then hopefully see the success of that, reevaluate, and we would be able to continue through the school year if that's something that is needed.
So right now it's Valpo and Chester.
Yes.
None of the township schools?
We had reached out to everyone. So with Hebron and Boone Grove, they work through, it's called Northwest Indiana No Child Hungry. And she is a nonprofit that services them through the school year. And she does the same thing through the school year. We had reached out to her. That was actually our first contact, hoping to be able to expand that into the summer. And she is working through how that might work for her in the future, but it's a big undertaking because it's really, it's one individual, and then she has volunteers who are wonderful. But one of the things that she's really concerned about is it being anonymous. She's really respecting the families who pick up and how that pickup would happen and who would, see. And so she's trying to work through some of that. So we've approached her for those two schools. We heard back from a couple of the township schools who just said that their need wasn't high enough to do something over the summer. And then I believe Portage may have some, we did not hear back from Portage Community Schools, but they may, I know that they feed all summer long, and they may have some funding to do some summer programs, and we did hear back from Valpo and Duneland.
Very good. Well done.
So that was very exciting. The next thing that I wanted to pop up is just the updated strategic plan, that last sheet. And I just kind of wanted to point out all of the green things. So the green things are all things that we've voted on and we've heard proposals about that are go. So those are things that are instituted, programs that are up and running with partners. And as you see right down here under these three programs right here, these will have all met their 30-day posting requirement as of the 7th, so this Friday. So Chris has all of those agreements. Colby's even approved some of them. Those will be, actually, we already have one signed from the Porter County Aging and Community Services, so they know that, it can't take effect until the 7th, but we're all ready to go as of that date. And so these are all things that we have voted to institute or we've instituted with partners, and that makes me very excited. And then I also, for the CPR training, I just wanted to give you a quick update because I know it was red for a long time and now it's orange. We have staff that are currently undergoing training to be trainers. So John currently can train and offer CPR classes. Jess is also going to get trained, as is Jeff. So Jess and Jeff. And then Jamie, who's working with us right now and doing some communication and work with the schools, is also going to train for that Heart Saver. And so that way we would have somebody who can go in and actually offer to school personnel, because oftentimes they come up and then they're trying to get their personnel in classes. So if we could get someone who could go to the school and offer that Heart Saver. So that is our plan for there, and we are very close. So the next thing I just want to put up is just, I wish this would go away. So this is just kind of showing all of the core services and all of the things. So if it's highlighted, that means we're either in the process of working on it, or it's something that we have talked about wanting to institute for next year. If it's not highlighted, these are all things that we've done this year for Health First Indiana in these different core service areas.
Well done.
And if there isn't anything there, it's not because we don't do anything. It is just because that is something that we do infectious disease prevention and control. Yeah, we already did it, so there wasn't necessarily any expansion in our arena or a need to add anything in that area. So if you, hold on, I have to enable editing and then I can make it whole.
Just do the slideshow.
Ah, thank you.
Right there.
Yeah. Up there at
Oh, for heaven's sakes.
see
The one that plays, I didn't want my slide to move.
There
we go. Thank you. I used the one at the top before.
I have no idea, so don't feel bad. I have no clue. Zero.
So anyway, this is just a really fun way to look at it, I think, and it is very exciting about how far that we have come. And as you look at this, and I can send it, please, if there are any ideas that you have too, these are just kind of ideas that we have, either things that we have in the works going forward that we know that there are more needs as we've gotten out and we're working with partners. So that, yeah, I'm sorry, I kind of lost my train of thought. So kind of things that we, have either in the works or in our brain in the works. So have further suggestions, and then there are, and as I said, for these other core services, these are just things that we, we're already in those areas, kind of doing those things. Of course, as we actually have a meeting next week regarding some of the environmental KPIs. That really isn't something that we have dove into. If there's something more that they are kind of suggesting that we maybe do or things like that, we haven't gotten a lot of information about that. And so we will have a meeting next week about that.
What about anything with the pest and vector? I will tell you, I have seen like a substantial increase of ticks in the last few weeks and people with tick bites. I don't know if you have. It's like the most I've ever seen. And
It comes in waves.
I don't know, I don't know because we had a warm summer, a warm winter or what, but I probably have several a week.
So as far as tick surveillance, we were just on the tick dashboard today, so IDOH
Good.
has a tick dashboard, and it's very, very interesting. The state does tick surveillance in our area, and so you can kind of go on and see the different areas where they do their surveillance and all the results that come out of that. And so that's kind of something that they do. As far as we do a lot of education. If somebody calls in about a tick bite, or they have a tick, or they bring a tick.
They bring it live. They got him off the body live. Like, well done. I usually kill them.
And so we just kind of do a lot of education and explaining for that about, we don't send down ticks for testing, that they come and they do the drags and they do the surveillance for the ticks. And, if we send one down, if it has Lyme, that doesn't mean that it transmitted it. And if it doesn't, that doesn't, so we just kind of do a lot of education about that. Now, as far as vector control with mosquitoes, when we get complaints, Dan will go out if it's a septic system that's in failure or a pool that's not being maintained or any other water. We have the dunks that we can put in there to eliminate that source. Zach, actually, that works for the environmental division, is kind of doing a survey of areas and because different municipalities do different treatment.
Yes.
And so we're kind of on a mission to figure out who does what that boundary looks like, and then what gaps there might be, because there may be gaps in areas where we want to see about doing some treatment.
Good.
And so that's one of the things that we've talked about in that area, and is on the list to get that information to see if there's anything further that we would like to do.
Gotta love summer.
And if you have questions, I will definitely send these pages to everyone too, so that you can look that over and see if there are any ideas or any questions you have or anything you want to talk further on. I just think it's really exciting to kind of see everything. We've done a lot of
6 months. Yeah. Wow.
A lot of
crazy. Good. Really have.
What's the residential on-site sewage system? I mean, if someone calls and wants it inspected, or
So-
how is that determined?
Yeah, so that is like if someone builds a house that cannot hook up to sewer, and they need to install a new septic system, then they come in and they get information from Dan, and he gives them the information on plan review. So typically they need to meet certain criteria for their lot and get soil borings, make sure that they know where this good, that. But then also, and so then they inspect the process along the way, make sure that it's installed correctly, that it's installed to the specifications of the design, the plan review and the design. And then also, actually, we've had several recently where we've had complaints of potentially failing septic systems. And so then they go out and they investigate those complaints. And thanks to recent legislation, that has become more difficult. because we actually, if somebody tells us that their neighbor's septic system is in failure, if we can't see that from the road or from the neighbor's house or driveway, we have to send a letter letting them know that we plan to be there on, in 7 days or more. And then on that date, when we show up, pumped it out, or, or they could not be there, and then,
We can't go in.
right. So, yeah, things have become far more difficult in that arena. So we do our best.
That's all you can do. And s-
Oh, okay.
And so coming up in the upcoming meetings, Carrie's going to give us care coordinator updates as well?
Yes, so then Carrie will start giving care coordinator updates in the coming meetings, and then the other thing that we will have, so we do have some data on the first responder mental health that
Yes.
I have some data on that, and then we will have data from our other evidence-based programs coming up at coming meetings. So they are just to the point. A couple of the Portage Y programs are actually underway. So I do know with her diabetes prevention program, the DPP that Shannon was talking about, as of the middle of May, they had 6 people signed up for that program, and they had kind of just started because we had just executed that contract in the middle of April. And then Shannon had gone on vacation. So that's exciting. That's a year-long commitment. And so they will have that program up and running. And they have their self-monitoring blood pressure program up and running. And there are the 2 balance programs, so from both of those. So we'll have a lot of information from those evidence-based programs as well to share. But right now, from our first responder mental health helps, we have reports. This is from the middle of April through the end of May. And so that was 6 hours of evaluation time, 8 hours of full contact time for Doc Shelby, 17 individual check-ins, and 2 hours in public presentations. And then he had some administrative time on there as well. So,
That's pretty significant for 1 month.
1 month.
yeah.
I hope they're looking into expanding that pay more than the 10,000 we agreed to.
I believe that they're expanding the program.
Yes.
What I've heard, maybe from some grant money that he's received that I've heard at the council meetings, so.
And I know I talked to like some city council people and they were aware of the program as well, to synergize this with the city and the county. And so it's, it's great. I'm proud of Sheriff Fallon and I'm glad that their first responders are using it.
Absolutely.
I'm glad to be a part of it.
And then I will also send you guys this information with the details, because it defines what evaluations are, what full contacts are, what check-ins
Yeah.
are as well. So that is information that I will send out along with these pages. And if anybody has any other questions about, in particular, about anything that we've voted on or doing, or how anything's going.
Those care packages, I'd read that you were taking them out. How does that go? How is that going?
So currently, they are they at the 3 locations? Do we have, so we have a whole list of locations to contact and see if
Whole library?
they would be interested. So right now, and these are the public health care kits,
That's what.
Valpo Library, the Portage YMCA, and the Chesterton Fire Department. Those were organizations that we had already spoken to that said that they would be willing and would like to have those to hand out. And so we have a whole list of other organizations all around the county to make sure that we get some, in Hebron and Couts and Porter, in all of our municipalities and areas where everybody can access them. And so that's exciting, because that gets, the supplies in a lot more locations around where,
And the word out.
yes.
Doing this.
And for example, at Chesterton Fire, they have outside of the fire department a free little food pantry. And so they were able to contact the organization that put that in place and find out if they could leave a couple in there. And so then it's accessible 24 hours. So we definitely have other options to make things accessible
Very
24 hours a day in even more locations. So it's worked out really well.
And are we ready, are we at a full launch of this Find Help? Like, almost there?
I will let you.
So, I mean, we have a press release that we can, put out there. It's just gonna be ongoing.
Yeah, oh, sure.
Yeah.
Programs. The social worker and I have been able to get about programs added. And then we have our summer intern who, I have her looking at a really good paper resource guide to see how many, that aren't listed, and really gather that information so we can submit it to Find Help to, hopefully expedite getting it added to the program. So it's active, we're promoting it, the magnets will go to individuals. Then we also thought, the little, like, 3.5x5 card is so that how organizations or individuals can help us spread the word. And I often reference it on Facebook on some of the help pages.
I've seen that, yeah.
So it's just a matter of really getting it out there. We believe we have our ref tags, which are how we can track how individuals are getting to it. So that QR code on that magnet is a particular ref tag, so we can know if someone it got to the site from the magnet. Or if they got to the site from scanning it up here or on printed material.
Very good.
So that is ongoing. We may end up adding a few more. And really, a ref tag is just portercounty.findhelp with a little extension of where they got to that and how they got to it. Sam is looking to get something on the buses. She talked about that before I came along, so we really want to get a push going, but I have a little bit of frustration with delay in getting programs added, but we're working with our contact on a better way to expedite that and identify listings that are high priority. So it's up, it's going, it'll be ongoing forever. And the community resource network meetings continue to be well attended, and that is a topic always at those meetings. And getting your feedback and helping to promote it.
Thank you.
And Carrie also mentioned our intern Hannah. So Hannah's with us for the summer. She is a global health student from DePaul University. She's in between her junior and senior year, and then she plans to go on to get her master's in public health. She's not sure where yet. She's getting ready to start applying, and she is great. I mean, she gets so much done. So she's working on Find Help and getting resources added. And honestly, they are the rate limiting step for that. So we are constantly asking, I think because of us, they're trying to look into how we can add things ourselves. She also is making a database of all the providers in Porter County. And we use that for referral purposes. So then the goal is that she'll start making calls so we can find out who's accepting new patients, maybe what insurance they're in network with, all kinds of how best we can communicate with them.
That would be.
Yeah. So, and then hopefully too, as we work with other individuals in outreach, then that's a database that we can give to.
Yeah, like Shannon
Yeah, like
Wood
that.
here, yeah.
Right.
Yeah.
Amazing.
So,
Very good.
And Carrie, I see that the bikes, 12 bikes have gone out, you said?
yes, and that might be updated. Is that 14 now?
So I've picked up 15. I have one gentleman, there's some communication, having a hard time getting in touch with him. So 15, almost 14 given out. And I have 4 or 5 applications on my desk.
Really?
And Carrie, the feedback from the state regarding this program that you've received?
Yes, so when, was it last year, after everyone's budget was due, they compiled a database of what everyone's doing, and they put it by county and what everyone's doing. And when people saw the bicycle program, people contact me all the time and want to know about it. It has spurred a lot of counties to be interested in starting a similar type of transportation program. I just printed out an email today from Tippecanoe County, and I give her a hard time because I'll get a text at like 8 o'clock at night, and she'll be on our website and she'll say, it said, "This is awesome. How do I find your application?" And then she'll send me another email and it said, "Never mind, the link's right here," and so I get a lot of emails from people on our website. "Your website's great. Tell me more about this bike program. This bike program's great. Is this something that you already had in place, or is this something that you're doing through Health First Indiana?" And we truly are seeing the bikes out and about and people utilizing them to go to their jobs. The one gentleman that he actually came last week and had gotten his appointment days mixed up and came back to meet with Carrie. But I mean, this is how they're getting to work, whether they're, at Hilltop or whether they're, at Respite House or Moraine House, and they're needing to stay in their job, and that's how they're commuting from there to work, and getting things that they need at the store. And the baskets are great because they're able to put, the one gentleman, he figured out exactly how many bags of groceries he could get in the basket.
Oh.
Six.
Wow.
Six on, I think it was on the back of a rack in like a milk crate or something.
Yeah.
Six. So, yeah, I'm getting some interesting stories and feedback. And so we didn't hugely advertise this.
No.
It's spreading by word of mouth through housing opportunities, maybe Moraine House, Respite House, 320. So it's and then those individual organizations are even reaching out to me and saying, "Hey, here's an application." So it's working the way we really intended for it to work.
And I love that we're innovative and leaders in the state, and I think that's always something we strive for here. So I'm proud of that.
Did it get discussed how we had the cost savings too with the bikes initially, at least, through Leo's bike shop, that he was able to find? Did we discuss that here? That he was able to
I
find
remember we've discussed
donated bikes or
The Dunes.
muchly reduced
Yeah.
bikes that came from Dunes Tourism?
Yes.
Yes, and those have,
They're gone. I mean, he sold some of them, but we were able to get, I gave away several of them. They were quite popular and everybody liked them. And then he and I, we talk all the time. And so he is also putting the word out there. He was a little hesitant at first because he had some bikes, but now he's putting the word out there that he's partnering with an organization to help provide bikes free as a means of transportation or a way to get to after-school activities, because they'll donate them. And we were concerned about storage for him because, he also has to make a living, but he has already received 2 or 3, because I said, "Hey, we're picking up," because we don't want to have to buy a really expensive brand new bike if we have a good used bike that
Sure.
is in great working
Recycle
order. Let's
Yeah.
recycle and reuse.
Of course.
And so he does a tune-up on it if it's needed, replaces the tire, and so, so he started putting the word out there so that we can, rather than having bikes all over, and then it keeps our costs low.
Yeah, that's what I was gonna say. Do we have, so would we be able to accept, does it go through Leo to us? So we can't directly accept bikes for the program?
I
I mean,
haven't talked about it with Carrie, but I tend to let them know to contact Leo because
Okay.
then we'll have a bunch of bikes at the
I was gonna say,
Yeah.
we don't want people just dropping bikes off, right? Like, so it goes
Right.
through, that's the, I know.
Gary might have gone in the front door with
Yeah.
So I
Yeah.
also do want to mention too, I have received an application for like a 9-year-old. I received it for the adult and the 9-year-old, but it was a really good story of and great partnership as I was able to provide it for the adult, and then Greg
Yeah.
also does free bike giveaways, and so I was able to give that gentleman his contact information, and so the daughter was able to get a bike ride. So now
Just this weekend, right? Councilman, you had your bike, yeah.
he was able
exciting.
to get a bike for his daughter, and then so not only is he getting around, but when his daughter's there, then they can go bike riding. So
Very good.
It's kind of a
All of us working together. I love it.
And we get a lot of referrals as well from the Odd Fellows and from Councilman Sims's program, so it's really, works really well.
So, yeah, if they don't qualify for ours, then I would prefer.
Very good. Very good. Do you have anything to add?
Well, I noticed if you go in this order, it completely eviscerates anything that I would say.
Well, I'm just trying, last time we doubled up, so. I'm trying-
Yeah,
I was like, what?
I
Like,
Yeah.
felt like it probably was.
Yeah, kind of.
But I think I can be relatively short. Looking in over these, we are probably working more efficiently recently because I'm looking at the things that are on this calendar, and we've reviewed all of these through current and including up through the hardship program, and there was a couple of different kind of, I guess there's going to be some advertising and that sort of thing. So we even approved some state release for public images within the last week. Now, those looked like they were cribbed from the state, but we were able to say that they were acceptable. And that's through today. Still working with Carrie. Within a half hour of coming here, I sent her something that she already learned from Dave earlier in the day, but it still counts. 'Cause I wrote it down, and so we were. As far as we're concerned, we went through. I was looking at this list of things. I don't want to get repetitive with it, but we're going full blast on most of these programs and making sure that they meet the criteria, have limitations, have specific criteria on each one of them, so that they can be the most efficient that they can. So I'm happy with that too on each one of these, that we're able to do that.
Joking aside, we've had a lot of programs that we've created and devised here. And so, like we mentioned, Dr. Stamp's work and Carrie's work and you and Dave's work, it's been, and so seamless. So, I mean, within the 30 days, everything's done. We have our contracts. The hard work that you guys have all put in is not unnoticed. We appreciate it.
Thank you.
All right. Dr. Stamp?
Thanks for your support.
Of course.
You guys are,
That's easy.
I really appreciate your support forever
We appreciate you.
and ongoing. And I will be here and continue to work hard for the health department until there is someone who can,
Suitable.
yeah, pick up the ball and run with it.
Very good.
And go to the health fair on
I can't wait.
next Friday.
We all pray for
We're really
weather.
excited about that.
everyone.
Good one.
Yep,
Good one.
Yeah.
we're all praying for good.
Yes,
Yeah.
yes.
Did everybody get a shirt?
Yeah.
Wanted a shirt? Okay.
I like it. I like the color too.
Yeah.
Yeah,
Crystal created that
they're awesome.
and printed them all off and put them all on shirts.
Really good. Yeah.
So do we have like assigned jobs while we're there, or are we just
Oh,
gonna
good
be like,
question.
are we
Mingle?
floaters, or are we
Yeah.
mingling? Like, what's our job? What's our role?
You're supposed to invite everyone you know and then bring them with you
And bring
for a fun time. Food trucks.
Yeah.
Yeah.
Okay.
So, yeah. And we are thrilled at your interest in coming and
I'm
all of your
excited.
support.
I'm
Please
taking
do not feel like
off
you have to be there for 6 hours. I believe our entire regional team from the North region from state will be here. We did invite many state elected officials. I have not heard from anyone that's coming. I haven't heard from Governor Holcomb's office, but I do know Dr. Weaver was committed already that day. So was Senator Braun and Jennifer McCormack. I heard from them. I have not heard from any of our senators or representatives whether or not they're going to be here, so maybe we will be surprised. And then, of course, we've invited our council and our commissioners and local officials as well. I do need to follow up with some of the local officials because it's been a little bit since I've reached out to them. So
Very good.
just
Done a great job. All right.
all of our schools, we invited all the superintendents. Sorry, Jess has invited all the admin, and Crystal's been reaching out to all the youth sports organizations, and so we're trying to get out flyers and make personal contact. So
Good. Very good. All right. I think we got it.
We haven't voted.
Oh, we have to vote to approve our claims and receipts. If we can have a motion.
So moved.
So moved. And a second? Demetrius?
Yes. Dr. Buck?
Yes.
Dr. Brooke?
Yes.
Kathy?
Yes.
Dr. Osano?
Yes.
Thank you.
Well, if we have any public comment? This is, yes. If you can sign in for us here, and there's a microphone for you. Thank you for joining us. If you don't mind signing in when you're,
Want to go over that one?
yeah.
Oh, okay.
You can come back and sit down and be more comfy if you'd like.
I need to stretch.
Don't we all?
I am Michael. Sit on.
You can walk with it.
Now it's on.
There you
Hi. I'm Michael Berry from the Town of Porter. I'm the Director of Development and Building Commissioner,
Oh.
Town of Porter. You may have seen some information about a property at Summer Tree. Passed
Last
around.
month, yeah.
Yeah.
Okay.
So back in September of last year, we had a 911 call, resident at Summer Tree who had a medical emergency. So our fire department responded, and they found the unit in atrocious condition, mostly human waste, some animal waste, and some other stuff. They contacted Mr. Boyd, who issued an order to vacate. I was then contacted. I issued an order to rehabilitate the unsafe structure. So for the past 9 months, I've been trying to find a way to get this cleaned up. So the homeowner is now in a nursing facility, and she's doing much better. She cannot rehabilitate the unit. We tried the HOA. The HOA is only responsible for the exterior because they're condominiums. So the homeowner is responsible for the interior. We tried the mortgage company and went around in circles with the mortgage company. So as often is the case, when orders are issued, it falls back on the local government to take care of it. So we put out quotes for rehabilitating, cleaning up the property. Got 3 quotes back on that. Right after I got the quotes back, we received a notice from an attorney that the property is now in foreclosure. I sent this information to the attorney and the mortgage company and have no response. So if it goes through the foreclosure process, that's going to take 12 to 18 months. We have a 2-story interior townhouse unit in a 4-plex that has a neighbor on each side of it. That is, and I'm trying to be nice about it, it's full of human waste. It's a very, very nasty property. It's getting warmer out, it's smelling worse, it's full of bugs and vermin and everything else. So we did receive 3 quotes. Our low quote is $14,058.60. And the town council is prepared to go ahead and pay for that. I know that the health department has some funding for some different, new this year, for some cleanup of properties. I know this isn't exactly what your money is for. We are not going to be able to get any recovery of the funds because it's foreclosure. There's already $185,000 worth of liens on a property that's worth $230,000 if it was in good shape. So we know we're not going to get our money back. Somebody asked me if all we're doing this for is to help the mortgage company. No, we're trying to help the neighbors who have to live next to this pretty bad property. So what I'm asking is if there's any shot at getting some money chipped in from the health department.
But you said that your town council is going to.
They asked me to come talk to you first, so.
I mean, I think
Yeah,
we're the last resort.
yeah, I know.
You know, I think if.
And we don't have a lot of funding available for this kind of thing. We're actually having a tough budget year this year. So they asked me to ask, so I'm here to ask. And I'm not asking for the whole amount, I'm asking for a small amount, or if you feel that's necessary.
Well, I think, you know, you were on the agenda at the last.
Yeah. Yeah, I wasn't
So-
told I was on the agenda.
Oh, well, sorry. So I think, you know, the appropriate path would be to return onto our agenda.
Okay.
And do, you know, we did get that sort of information all
Right.
relayed to us. All of us on the
Right.
board did receive that, the pictures.
Right.
All of those.
Yeah, it's pretty bad.
It's pretty bad. I personally, and then we can really have an honest
Sure,
discussion, more than a
absolutely.
3-minute public comment. I personally would like to hear more of the impact that this is having on the neighbors so that we can really assess this
Yeah.
as a public health risk to value us to be involved.
And would it be useful to have some of the neighbors? come?
Absolutely.
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 And they're coming to all.
And even if they can't come, if they want to write a statement,
Yeah.
you know, of how,
I can get that.
you know, because it does feel like we are helping the mortgage company at this point. We're
That's what I have been,
Yeah.
I have been told is you're helping the mortgage company. I said, I have no intention to help the mortgage.
I know you don't. Yeah,
I want to help the neighbors who have to live next to this.
absolutely.
And to Dr. Boxam, I think having a number and saying like, this is what we need left over versus how much can you chip in?
Yeah.
Kind of having that plan, because even if we allocate, I don't know, 2,000, 5,000.
Right.
And it still falls through, then why did we chip the money in the first place?
It's not going to fall through. It'll get done. It's just, like I said, my council asked,
Right.
because we're aware there's some funding. Again, it's not exactly what it's for.
No,
Right.
but we do have new funding, obviously, but
it's
you know,
really more-
if you watch the meeting, there's a lot of where.
I know. Yeah,
So-
and this has been a very interesting meeting.
So-
I'm diabetic, so.
Oh, good.
Let me ask one other
Sure.
question on
Go ahead.
this. Let's say nothing happens and it stays in foreclosure, like, is it gonna go up for public auction? Like, what's gonna happen?
They can't sell it in the condition it's in.
Right,
Actually, there was a realtor involved before it went into foreclosure, and they can't, number one, it can't go on the property.
right.
They can't sell it like that, so
It just sits?
it just sits there and festers, and that's the
At
problem.
some point, the mortgage company or a bank would have to intervene then, or they're just gonna let it.
They're
Oh,
they're gonna go through the process, which will take months, and it's just gonna stay that way.
So, you know, so what we would need, for myself, is how is this impacting those neighbors?
Right.
I
Yeah.
obviously acknowledge that it must.
Okay.
And that would help us meet those requirements of a public health issue.
Absolutely.
You know, because without that information, it does seem like a mortgage or a bank bailout.
No, yeah.
You know, so then we can, you know, pretty it up for them to then now recoup their, you know.
And basically, the quote is to remove everything from the unit, take out all the carpeting and flooring, and then just leave it that way. Paint. There's some walls. There's shared walls in the units. Some of them are compromised, so we need to patch the compromised parts.
The quotes were very specific, they were well done, very specific, what the occupant wanted left there, what,
Yeah, and I've actually removed all her personal
oh,
belongings.
that's kind of you.
I asked her what she needed out of there. I went in and got it out, so it's gone.
I'm glad to hear
In
you're doing
return.
better.
Because
Yeah.
I don't, trying to help her.
No,
Because I think our concern too is setting a precedent of
Right.
doing this, right? Like,
Yeah.
this has now become public knowledge that the health department would aid in this kind of,
Bailout.
activity, bailout.
Correct.
I mean, we don't want the floodgates to open and then say, well, Porter,
Yep.
you did it for them, why don't you do it for us? Or, and so I think within the spectrum of what is this as a public health issue?
Yes.
And what role do we have to play in that? Because we are not the cleanup crew.
Correct.
We're not, bailing people out. So,
I agree.
yeah.
Yeah.
We would like to hear more.
Okay, I can do that.
I think in the past, we have helped by, and maybe we've paid for the dumpster or some other way that we could help.
Assist, but not.
Generally, you would be assisting the homeowner that maybe can't take care of the issue. This is just more sideways than that.
Yeah.
Yeah.
Yeah, but
Okay.
I think it's possible,
Yeah.
but it's.
Certainly if we hear these neighbor
Yeah.
statements, I think it's something
All right,
that could move the pendulum in that direction.
go ahead.
May I ask?
Of course.
Sure, absolutely.
Did you have a date? You said 2 to 3 months for did they actually, is it scheduled for sheriff's sale? I looked.
It's right now, it's in a foreclosure. Did I send that to you? I could send you the document.
I went and looked it up.
Yeah,
so
it's just started the process. Codilis Law is handling that.
Yeah.
I have all the information. I could send it to you. But it hasn't gone into a sheriff's sale or anything yet.
Yeah, it hasn't been ordered for
No.
or anything at this point.
But it did get sent to Codil.
So they told you 2 months?
No, they haven't told us anything.
Okay, I thought I heard 2 months. I was like,
It'll.
no
it'll
way.
12 to
take-
18,
it'll
12 to
take
18.
12 to 18.
12 to 18?
Yeah.
I'm having a problem with my left ear tonight.
Oh, that's okay.
It goes with my eyes.
I heard 2 months. I was like,
Oh, no,
"Dude, it's
no, no.
not even ordered yet. We just started.
It takes forever to go through the process.
That part I know about. It's not going to
Yeah.
be 2 months.
No,
I'll tell you that.
no, no.
But
Okay.
yeah,
We can do that.
We would,
Appreciate the,
absolutely, yeah, we would be happy to hear
all right,
it.
thank you.
Thank you.
This doesn't have any bearing on necessarily the situation, but I just wanted to comment that I spent some time talking with Mr. Barry on the phone about this and some other, and he is a huge asset to the town of Porter up there. I mean, the
Thank you.
care that he has for the residents up there, and the work that he does above and beyond his job, I just had to say that.
Very nice.
Thank you.
Thank you, thank you.
Anybody else?
Councilman Sin.
You want me to sign in or?
Yes. Correct, and follow the rules, yeah.
You might have taken the sign-in sheet.
Oh, he may have taken the signage.
I get to sit
Pass
here.
chaos.
Yeah.
Yes.
Yeah, normally
You
I'm.
like it on that side, yeah.
Yeah, no, just I just need, because I'm gonna get calls on this. You're gonna be full-time now and until we find somebody else? Because I remember you saying you're only here a little while now. I just want to make sure I understand that. So Dr. Stamp will be our full-time doctor until you find somebody else.
She's just, we created this position, right, for the new health officer.
Right.
So we are going to compensate her in the same amount that position would be.
Agreed.
Yes.
I don't disagree with any of it, but it's just, if you're gonna pay her $150,000, then that's full-time, correct? And before that, you had made a comment about you're not here every day, but you will be here every day now that you're getting the full.
Well, the health officer position doesn't have parameters of,
And it wasn't earlier as.
No.
When you.
No.
Okay.
No,
And I was misunderstanding on that.
no,
That's why I want clarification, that's why I'm.
it doesn't have strict parameters so that
Okay.
we can work with whoever chooses to apply for this position.
Okay.
So that we can move up to a full-time role, and even expand upon that. So if someone says, hey, I only have 2 or 3 days available, we can discuss compensation there.
Okay, that's all I.
But the thought process is with Dr. Stamp in particular is that we know what she's doing.
Oh, believe me,
Yeah.
we even talked about that. It should have been her right from the beginning. I mean, that was.
Well, it just didn't exist.
I-
The title and the position
Well, I
didn't
get
exist.
your concern, and I think the answer to the question is the fact that I think Dr. Stamp is going to step up to whatever duty is put in front of her.
She already has.
That's well, but going forward,
Yeah.
she's going to continue any duty that's asked of her. She's going to. So in my mind, that's a full-time position, even if she's not here every single day. She
Correct.
takes care of every duty that comes in front of her as a health officer.
I mean, when did you put in your desire for retirement? January?
January.
And so,
Right.
there's been no,
Oh, no, believe me, because I'll get the calls of, well, she's getting all this extra money, but she's not doing any more, so what's going on? But now, with this being said, that's not the case.
we've changed.
And I'm okay with, I mean.
No, this is valid.
As long as we're on the same page, I'm.
Valid because this is what we're
Fine.
gonna hear.
Yeah.
We
Yeah.
have changed the description of this position. This position didn't have the description prior to this. It really didn't have any parameters of any sort. And so we really anticipated at this point in time, honestly, to have an overlap time, really, with Dr. Stamp and training a new
Right.
health officer. And that hasn't happened, so we budgeted for this. And if she's willing to stay on and fill this role, why should she not have what was available?
I agree with it all. I mean,
No, but I want the devil's advocate. I mean,
Absolutely.
That's,
Well, because I'm,
Sure.
like I said,
yeah.
And furthermore, her responsibility is going to
Yeah.
actually increase once we do bring on other people, because as she mentioned, she's going to be spending more time not only doing her job, but also teaching
Right.
new people.
Right.
So there is that aspect of the
Yeah.
that she's going to be investing. So,
Thank you, Councilman.
Oh, no.
I already have my list. I know this was a surprise to me. So,
It wasn't her idea.
right.
Any realm of
So I can't make a commitment to being here, 8:30,
Yeah.
4:30 every day. But I do have a list already that I've been sitting here
you go.
making
Wow.
as things that I will make sure the time is spent wisely and the money is spent wisely, and that I'm here working for the health department
And also,
doing what needs to be done
she's
for us.
also working on the recruitment of this position as well.
I know you all are. I mean,
But she really has, been working on that and coming up with brainstorming ideas so that she's helping us devise a plan to move forward without her.
again, I don't disagree with any of it.
But we need this.
Yeah.
Because if you're gonna have these discussions,
Yeah.
we need to have these discussions.
I mean, if we get called into question on our judgment or ability to judge judgment, we want to know that before
Yeah.
having to take it from the public. So I don't disagree with that.
Yeah.
Right, because I think our definition of a full-time worker, that is subjective to some, she's not, maybe not physically sitting in the office, but she's calling people, she's emailing people, I mean.
Meetings.
And you guys made that clear, which was good.
Right?
Yeah, absolutely. Late at night. And
Verify.
I get, yes,
these
absolutely.
Hours that.
Absolutely.
So I think as far as if people challenge you with the definition of, she may not be physically sitting in her chair.
Right.
8 to 5, she's doing
Right.
other activities.
But the
Yeah.
description doesn't
That
have
wouldn't
those
even
parameters.
be-
Yeah.
Yeah, that's not even required.
And I can also promise you I'm not double dipping or whatever.
No, that was.
My PRN job
Uh,
is really minimal. My hours worked outside of this building are pretty minimal at this point too.
And that's
Less
what's
than
made
12 hours a week.
That's what's made her so amazing. She really has worked for years above and beyond what she's been compensated for. And which really caused us, when we were sitting down and devising this position, to be like,
Why haven't we given us?
we're never gonna get this for this type of, look,
I remember that, yeah.
I mean, look at where we are now.
I mean, just being realistic, because I know what physician salaries are. The physician salary that she's getting paid to put almost a full-time job in here comes nowhere close to what a primary care physician would be
Right.
making if she was a full-time primary care physician. So at the end of the day, she's not making anywhere close to if she were a full-time
Right.
physician.
But what she was getting paid previously wouldn't be a full-time.
And I know that was a,
Right.
yes, and I agree with that as well.
Right.
That was
So-
terrible.
This,
I
and
agree.
I think we
agree.
need to send that message that we appreciate this
Value.
position,
Yeah.
this value, the value this, because I think things have been a little nuts the last few years, let's be real. And so, right, just a little. And so we acknowledge that and we invest in this position. And she's included in that because she's staying on to help us. So certainly I welcome any questions regarding that.
No, I just for clarification, yeah. it's-
One other thing, it's also incentivizing her to stay to make sure the transition happens, because obviously we're
How
not
long?
making headway.
Yeah.
Exactly.
I mean, I feel like, at some point, we're gonna have to go to the drawing board and figure out how this works, and, I don't know
Yeah.
all the answers to that, because I don't know all of the pitfalls of why we're not. I mean, I've had some, responses in terms of why, but it's not always a salary thing either,
Right.
So it's a different type of job. It's right now not really involving any clinical care. So there's just different things that people want out of their medical career. And so, yeah, but I appreciate that. And if there's any clarification, I know we'd be happy to.
I really think you addressed it all, and it's absolutely fine. And if people, we'll just tell them to watch this. And,
I mean, it's there. The money
yeah,
was there.
all good.
Yeah, she's now filling the position of what we were asking for into
Absolutely.
that position. So we're not asking for anything that we haven't approved already.
Right.
And I want you to know that
And we approve too, right, yeah.
on my to-do list, number one thing was to talk to you about it.
It's all good, you can check that off. Yes. So.
I mean, and the other thing, and I'll leave it on this, it's like, hey, Dr. Stamp, can you stay and do the job that we're gonna pay somebody more after you walk out?
Exactly. Feels bad after that. No, really, that's exactly it. In a nutshell, it feels awful
Exactly the
at
thought
that
process.
point,
Right.
and so, it's just not right.
Recognized
Probably a long time ago.
Well, yes, like during the
No, you didn't do this. Yeah.
during the pandemic when we were at the pod and beyond for, I believe, probably 36 was the pay at that time.
Oh, yeah.
Yeah.
Which, come on, I mean, a medical assistant makes more than that.
Yeah.
So this is long overdue.
Don't disagree with it all.
Motion to adjourn?
Thank you.
Well, you're just gonna be rolling in.
Well, no, I mean.
It's legitimate. It's legitimate.
Is that it?
Yeah, I need to